All right, welcome back to ABA exam review and the continuation of our BCBA practice questions series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe for all of our updates. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A functional behavior assessment for a new client identifies several domains that need to be targeted through intervention. These domains include communication goals, social goals, and behavioral goals. Based on the concept of social validity, what goals should be targeted first? Now, this is a goal selection question, and we are looking at the goals through the lens of social validity. What does social validity say? It says we need to pick goals that are meaningful and that are going to have an impact on the client and the people around the client. Now, if we've done this assessment and we have all these different domains across different areas of communication, social, and behavioral, we've got a lot of things to choose from. What you want to be careful about as a practicing analyst is trying to accomplish too much too quickly. We only have enough time in the day, we only have a certain amount of sessions. So you want to be smart about what we're targeting. And while some goals may not be the most impactful goals there are, you need to try to prioritize things that are going to be meaningful both in the short and long term for your client. And so, if we're trying to identify the goals that we are going to target first based on social validity, what should we choose? A, the goal that will have the most immediate impact, small or big, on the client's life. Now, immediate impact is good, but when we say small or big, we're not really sure what that immediate impact will be. If you just master a simple letter identification goal one time, well, that's going to have a small immediate impact, but is that the most meaningful target we could choose for that client? Are there other things we should be worried about first as far as goals go? Now, should we not target that letter identification goal? Maybe, maybe not. But if we're thinking social validity and what we're going to target first, we want to be sure we're targeting the most meaningful possible goal. So, B, the goal that will have the most immediate impact, small or big, on the people around the client. Also important, we're not just working with the client. We're working with the people around the client that we call stakeholders. And the changes we make for our clients will affect those stakeholders as well. However, again, we're looking for something that is socially valid. So if we look at C, the goal that will produce the most meaningful change for the client. If we're worried just about social validity and we're based on the concept of social validity, we're looking for the goal that will produce the most meaningful change for that client. That's the idea behind social validity. It's going to prevent you from picking goals that aren't worth targeting or just aren't worth the time to target, because you're going to get asked to target a lot of things by stakeholders, and you, as the analyst, need to pick and choose what's actually worth your time. And then D, the goal that can be achieved the quickest. Well, of course, we're not just going to go by what can be achieved the quickest, because that could be anything. And if it can be achieved quickly, a lot of times it might not have any meaning at all. And so if we're looking at social validity, we're going to target the goal that will produce the most meaningful change for the client. After spending some time with Jake, you start to notice that he engages in significantly less escape maintained behavior when he got a good night's sleep the night before. You encourage Jake to go to bed earlier and establish a nightly routine so that he can sleep well. A good night's sleep is likely acting as blank relative to escape. So, what is the question asking? It's asking about this good night's sleep and how it's affecting escape. Well, what do we know so far? We know Jake engages in less escape when he gets a good night's sleep. So, we can say when Jake sleeps well, he engages in less escape behavior. So, why is that happening? What effect is that good night's sleep having on Jake? And remember, when you're answering these questions, we have to think in behavior analytic terms. We can't just say, well, Jake is much more well rested. We have to think, what behavior analytically is that sleep likely doing to the consequence of escape? A, positive punishment. Well, the good night's sleep is going to be the antecedent to less escape. It's not going to punish the escape behavior because the sleep is not a consequence. So it can't be A or B. It's not positive or negative punishment. Although escape is decreasing, it doesn't necessarily mean it's being punished, because the good night's sleep is coming before the less escape. The good night's sleep is an antecedent. And so what we're looking at here is a motivating operation. Now, what effect is that sleep having on escape? Is it making escape more valuable or less valuable? Well, it appears it's making escape less valuable, because Jake is engaging in fewer behaviors to contact escape. And that's the idea behind our MOs. They're making consequences either more valuable or less valuable, which leads to a change in behavior temporarily. So when Jake gets a good night's sleep, the value of escape goes down. So it appears that a good night's sleep is likely acting as an abolishing operation relative to escape. That's a more challenging motivating operation question. So if you work through it, fantastic. If not, that's okay. Stop here and review. You should be using these questions to review all these different terms. You teach your client how to identify apples, oranges, and bananas. The client is now referring to the apple as fruit, but does not call the orange or banana fruit. If you wanted to encourage stimulus generalization, what would work best? So let's start with our term. Always start with the term if you're given one. And stimulus generalization says what? Well, it says you're going to have a response occur in the presence of different stimuli. And so what response do we want? Well, we want this response of fruit. And we want fruit to start occurring across all these different types of fruit. So they see the apple and we have it. We want them to start saying fruit for orange and banana. How are we going to encourage that? Because when we think about stimulus generalization and response generalization, a lot of times those behaviors just are derived. They occur without teaching. But if they aren't derived and they're not occurring, then we can give them some assistance, obviously. And so if we want our client to start identifying all these different types of fruit as fruit, what can we do? A, reinforce the client when they refer to orange or banana as fruit. Sure, that's the most obvious answer. And that's why parsimony is so important. Because don't think just because it's a simple answer, it's wrong. Parsimony says simplest explanation is often right and is often where we want to start. So if you want them to say fruit in the presence of orange or banana, we'll reinforce them when they say fruit in the presence of orange or banana. A looks good. Let's look at B. Reinforce the client when they refer to the apple as fruit. That will continue or maintain the apple being called fruit, but it's not going to help with oranges or bananas. And then C, punish the client when they do not refer to the orange or banana as fruit. Punishment is not going to increase anything. It's not going to encourage stimulus generalization. It's going to decrease some behavior. You can't teach through punishment. Remember that. If you're trying to increase or encourage or improve, punishment is not going to help because punishment decreases. So if you want to encourage stimulus generalization, what you want to do is reinforce the client when they refer to the orange or banana as fruit. Lucas does not engage in many forms of problem behavior, but he will use bad language after overhearing his older brother speak. Lucas's parents decide that they will give Lucas $1, but only if he doesn't use any bad language for the entire day. What differential reinforcement strategy does this resemble? So we have a differential reinforcement question. And when you get a differential reinforcement question, first thing you want to ask yourself is, am I teaching a replacement behavior? If you're teaching a replacement behavior, it's either going to be a alternative or incompatible strategy. If you're not, it's going to be a DRO, DRL, DRD, or DRH. In this case, are we teaching a replacement? Well, we know Lucas uses bad language when he hears his older brother speak, and then Lucas will earn $1 if he doesn't use bad language. So they're not necessarily teaching him something different. They're just rewarding him for not doing it. And so we know we're not teaching a replacement. Now, when does Lucas get that reinforcement? He gets that reinforcement for not engaging in a behavior, for the absence of a behavior. And when we reinforce in the absence of a behavior, what do we call that? A, alternative, like we just talked about. With alternative differential reinforcement and incompatible differential reinforcement, we're teaching a replacement. If we're not teaching a replacement, it can't be either one of those. So A and B are out. What we're looking at here is differential reinforcement of other behavior, because when we use a DRO, a differential reinforcement of other behavior procedure, we reinforce in the absence of a behavior. In this case, Lucas gets that $1 if he doesn't engage in bad language for the whole day. So in the absence of the bad language, Lucas is receiving reinforcement. And then obviously we don't want D, higher rates, because we're not trying to increase Lucas's use of the bad language. Pretty straightforward differential reinforcement questions. Start developing these little strategies to get to the right answer. Eventually they'll become second nature and you'll move through these pretty quickly. Dr. Blue recruits participants for a research study involving children and their parents. The parents sign consent forms agreeing to participate with the knowledge that the interventions may cause some distress to their children. During the second week of intervention with one child, there are signs of distress, and the parent requests that Dr. Blue stop all intervention and to not use any of the collected data. What should Dr. Blue do? If you're thinking about going into research, which is a great path as far as ABA goes, you have to be very concerned with ethics behind research. Now, you might say, well, I'm only a clinical BCBA. I don't have to worry about research. At least for the sake of the exam, we've got to know the ethics behind research because it's part of the exam. And so when we are doing research with clients, we're still BCBAs, so we're still bound by our code. And as always, the number one thing is we do no harm. Now, in this case, Dr. Blue is recruiting a participant for research study involving children and their parents. He gets consent, which is great, and he tells them there might be distress. However, when distress occurs, now the parent all of a sudden wants to stop intervention and not use collected data. That puts Dr. Blue in a tough spot, obviously, because this is his research. He has to have data, and it's going to be difficult for him. Can Dr. Blue say, well, you consented, and so you've got to continue with the research procedure? What should he do? A, explain that the parent did provide consent and that they were aware that distress was possible. That's true, but the parent doesn't want to do the intervention anymore. Dr. Blue cannot stop the parent from quitting and dropping out, and then he can't use the data if they don't want him to use the data. It's just like in clinical practice, clients and stakeholders are free to quit at any time. B, ask the child if they would like to continue and do what the child says. We don't know how old the child is, especially if the child's younger and can't consent themselves, then it's not going to be up to them. It's going to be up to their guardian or stakeholder. C, stop all interventions on the request of the parent. Unfortunately, yes, that is what Dr. Blue would need to do. And then D, discontinue the research study entirely. He doesn't have to discontinue the whole study, but with this particular participant, if they say they're done, don't use my data, Dr. Blue has no choice but to comply. All right, thank you for watching. Check out behavioranalyststudy.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. As always, work hard, study hard, and we'll see you soon.